We are one of the most, I don't know if it's disliked, but we have a reputation issue as an industry. And I think to pick up what my colleague said, I think we need to be far more transparent about how we act and what we do, be it pricing, be it how our business practices are. But I also think we tend to talk about just the successes. And I think as an industry, we need to start talking about the failures we have, particularly in research and development. I mean, I think if we start to communicate how often we fail, but we never give up, and that happens every single day, then I think actually people would understand that we only talk about the successes because we're very proud of those. We don't want to talk about the failures because I think they have an issue on some of our stock prices maybe. But I think if people understood the entirety of the challenge we face in addressing some of these unmet medical needs, then, but the fact that the industry doesn't give up, and many of these employees and associates and scientists, Gitte talks about, just never give up for whole lifetimes. I think that's what we got to focus on, so the entirety of the story. But I think we do ultimately need to walk the talk in how we behave as an industry out in the marketplaces, which I still think there's an opportunity to improve.
I recently saw data that were comparing lifetime expectancy in China and the US, and they're almost the same. But obviously, if you look at healthcare expenditure per capita in China and the US, they are way apart, right? That's a challenge for society, but it's certainly also a challenge for the healthcare industry, and I think we need to own that and take part in that conversation. To your point earlier, to the point that was made earlier, I mean, if we are not at the table, we are probably at the plate.